非常感谢大会邀请我参加这个会议。我是香港理工大学的梁子文，今天非常高兴跟大家分享一下，我们在香港跟世界卫生组织参与一起工作的事项。这个工作是跟老人综合护理模式有关的，就是为了大家容易明白我的发言，我想我是比较好用我的英语跟大家讲一讲，好吧？Thank you very much for inviting me to join this conference. I am Angela Leung from the Hong Kong Polytechnic University School of Nursing, and very glad that we are able to talk about the work that we have been working with the WHO in the Icope model. So let me introduce the center first. The WHO Collaborating Center in Hong Kong is the first and only WHO Collaborating Center on Aging in Asia and the Pacific. We aim to assist the Western Pacific region to roll out the strategy initiatives on aging for the region. Our work mainly focuses on three areas. The first is to understand the key indicators of aging and health in the countries in Western Pacific. And then we would like to promote the WHO guidelines on integrated care for older people, Icope, and develop initiatives to disseminate and implement it in Western Pacific region countries. And we also consolidate good practices and policies that ensure healthy lives and promote well-being of older people in the Western Pacific region. So over the last year, we have been working very hard, and we have already offered 12 monthly webinars. And we also help WHO to review the Icope handbook and review the findings of the pilot program. We also develop contextually relevant Icope training materials for different countries. And we work with Cambodia Ministry of Health to work on the Icope model, as well as the government in Hong Kong to work on the caregiver study. In the last year, we have already published 66 papers, make good use of the big data, as well as doing some study on the people with cognitive impairment or dementia. As COVID is one of the big issues at the moment, so we also work on study related to the situations related to COVID-19. So as the center, which is responsible for supporting the Icope implementation, we help to develop and support the curriculum development. And we also offer consultancy service to different countries and work with the Ministry of Health and NGOs. And we provide tailor-made training curriculum in Western Pacific. And at the same time, we also conduct our own study in Hong Kong so as to capture the important evidence that we can have for the Icope model. As we all know that the United Nations, UN, has already declared that in the next 10 years, actually we focus on the healthy aging. And this United Nations Decade of Healthy Aging is the key document. and that is to be implemented by WHO. So the United Nations Decade of Healthy Aging is a global collaboration bringing everybody together, including the governments, civil society, international agencies, professionals, academia, the media, and the private sector. So in the next 10 years, we hope that we can work together so as to foster longer and healthier lives. So this United Nations Decade of Healthy Aging document actually tried to seek help for everybody to reduce health inequities and to promote and to improve the lives of older people, their family members, as well as the community through different kinds of actions. And the actions can be categorized as 4 big areas. Firstly, we would like to change how we think about aging, how we feel, we think, and we act towards aging, and avoid ageism. Secondly, we would like to seek collaboration from the developing communities so as to foster the abilities of older people. And thirdly, we would like to deliver person-centered integrated care and primary health services in response to the needs of the older people. And lastly, we would definitely like to provide older people with some support so that they can get good access to the quality long-term care service. So when we talk about the concepts of healthy aging, we are referring to the fact that everyone should have the opportunity to live a long and healthy life. But we have to pay attention to the environment. The environment we refers to the situations that we love to live in, and we are able to do something that is favorable to our health and do no harm to it. When we talk about environments, actually we know that the environments would influence our behavior, and at the same time it would influence our exposure to health risks. From that, we would be able to assess quality health and social care as well. So this is very important to get to know that the environments actually affects our access to all this care. So when we talk about healthy aging, it's all about creating the environments and opportunities so that people can do what they like and what they value throughout their lives. So everybody would experience healthy aging for the hope that we can be free from disease, and at the same time we should be able to live a longer and healthy life. WHO defines healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. That means that we try to emphasize the word functional ability. Functional ability refers to the capabilities that enable all people to be and do what they have reason to value. So that means that we allow the functional ability allows the persons to do something that they value. Different people may value different things. But anyway, we want to see that functional abilities actually refers to individuals' ability to meet their basic needs, to grow, to learn, and make decisions, and at the same time they are able to be mobilized and they are able to build and maintain relationships as well as contribute to the society. I think that here the key is that it's not only restricting to the basic needs, but it is talking about the growth of the individuals and how the individuals can maintain their relationships as well as contributing to the society. Functional ability can consist of two important parts. One is about the intrinsic capacity and the other is about the environmental characteristics. When we talk about functional ability, it is referring to the interaction of the two. Intrinsic capacity refers to all the mental and physical capacity that a person can draw on, and that includes the ability to walk, talk, think, see, hear, and remember. So the level of intrinsic capacity can be influenced by many factors, such as the presence of disease, injuries, and age-related changes. So when we talk about environments, it is not just restricted to the physical environment, but that refers to the home, the community, and the broader society, and all the factors within them are considered. For example, the built environment, the people over there, the relationship with the clients, the attitudes and the values of the people in the society, the health and social policies, as well as the whole system. So all these may also affect the people's health. So if the environment is supportive enough, then the person would have a better health. Well, we used to talk about active aging, but nowadays we are talking about healthy aging. Healthy aging becomes the focus of the WHO work on aging between 2015 and 2030. So healthy aging actually replaced the previous focus, that is the active aging. It becomes a very key framework nowadays in WHO. So when we talk about healthy aging, we actually talk about emphasis, the need for action across multiple sectors and enable everybody as well as the older people to remain as the resource to the family members as well as the communities and economies. So with this healthy aging in mind, then we know that we have to talk about this model, the Icope model, the integrated care for the older people, Icope. So Icope actually is a community-based approach towards the people. Here we talk about a person-centered health and social care. The ultimate goal is to maximize the functional ability of the older people in the society. The Icope framework aims to assist health social care workers and caregivers to screen older people at risk of care dependence in the community and perform a person-centered assessment in healthcare and design a personalized care plan. So when we talk about healthy aging, we refer to developing and maintaining the functional ability that foster well-being. So you can see that we are talking about intrinsic capacity here. The intrinsic capacity composes of all the capacities like physical capacity as well as the mental capacity of the person. You can see there are 6 key domains of intrinsic capacity here. The first is the locomotor, then the psychological capacity, the cognitive capacity, hearing capacity, visual capacity, and vitality. Vitality refers mainly to the nutritional parts of the person. So in this graph, you know that we are referring to the functional ability, which is the blue line, okay? The functional ability, we try to maintain the functional ability as much as possible, even though the intrinsic capacity would gradually decline due to aging. So we are having a upward push over here is that we try to maintain this functional ability as much as possible. So if we work on the Icope approach, we are trying to understand that there is a certain level of decline over the time, but at the same time we try to maintain functional ability as much as possible by different kinds of services and long-term care service. So Icope model can be divided into several stages. The first stage is about screening. So here I try to show you that the screening is very simple. We are using 9 items to assess the person's intrinsic capacity. And then in the second stage, we are going to go for a more comprehensive assessment using various tools. And yet, we are going to cover the 6 domains that we have just mentioned. Other than the 6 domains, we would like to assess whether that person actually have sufficient support in the community or not. So with all the assessment, then we go for working out a personalized care plan. This is an example of the care plan that we use in Hong Kong. We try to discuss with the clients and see what kind of resources the client has, and then we try to make suggestions on how to improve their health through this care plan. So we have conducted pilot studies over here in Hong Kong using the Icope model. And we assess about 300 people, and we see that a very high percentage of the clients actually have intrinsic capacity decline. About 70% of the people actually have such a decline in various domains. And the most significant domains that has a decline is the locomotor capacity, followed by the psychological capacity. And the third highest decline is the cognitive decline. Using the comprehensive assessment in stage 2 of the Icope model, we found that about 60% of the clients actually has at least one or more decline, and we see that the most significant decline is about the locomotor. So knowing the intrinsic capacity decline is important because if the person can maintain a good intrinsic capacity, that person would have a good self-care. they can take care of themselves. But if they at the same time, if they have a good intrinsic capacity, they are able to engage to the society with other people as well. So from this diagram, we can see that maintaining a good intrinsic capacity in the old age, this is very important, and that can help to improve the self-care capacity as well as their engagement in the society. So our experience actually tells us that it is very important to conduct comprehensive assessment for the older people so as to understand about the level of intrinsic capacity. And at the same time, it also gives us an opportunities for us to discuss with the older people and their caregivers and set up some personalized care plan. And this personalized care plan would be very important because it is based on the individual's resources. The assessors in Hong Kong, we are using we are asking nursing students to help out. So we have the opportunities to know more about the needs of the older people. And once we know about their needs and their levels of intrinsic capacity, we are able to discuss with the frontline workers who have close contact with the older people. And these frontline workers will be able to talk to the caregivers at home. And finally, we found that doing a comprehensive assessment in the community is not that difficult. It just takes about 60 minutes or so to conduct a whole comprehensive assessment, and this is very valuable because we found that we are able to communicate with the older people, and we get a very good experience to learn about the community resources that is being available in the district, in the community. With all this understanding, we are able to discuss with the older people and see what we can provide to them. So working with the older people to look at the intrinsic capacity, and then we can be able to work out some good strategies to support them so that they can live in the community independently. So as a conclusion, we would say promoting healthy aging is very important in old age. By using the Icope model, we are able to understand the intrinsic capacity level as well as the functional ability of the older people. So with all this, we are able to provide some good care plan for the older people and work with them. So that's all I have prepared, and I hope that this can give you some ideas about what is healthy aging and how we can support the healthy aging by using the WHO Icope model. So I welcome questions from the floor. Thank you.